Alright, we are live.
Good afternoon and welcome to the last Alvernia Live Chat for 2025. Welcome, and my name is Dr. Terence Tan. I'm a pediatrician who practices at North Alvernia. And today the topic is holiday health, protecting your children against respiratory illnesses, especially this season when everyone is traveling. So I'll be sharing and fielding questions from the various social media platforms regarding infections during the holiday period. So leave any questions that you have and I'll try my best to answer them. And as the holiday season approaches, we hope that everyone is healthy and we have a good holiday season without too much infections or stress happening to parents. So as part of my work, I see many kids who have infections. Respiratory infections is the most common type of infection, not the only one, but very commonly influenza and other respiratory viruses affect our kids, especially when the family travels overseas. But not only when the family travels overseas, even when the kids don't travel, other family members or friends traveling overseas may bring viruses back. So respiratory infections from overseas do come and visit our shores. So because of that, it's a real problem, especially during the end of the year and to some degree even the June holidays. So the first question I have is, what are the best top ways to strengthen a child's immunity that actually work? The children's immune system is very fantastic. Kids can often fight infections and get stronger. So falling sick itself is one of the ways the body gets stronger and builds up resistance. So actually avoiding infections is not possible. Whether the kids go to preschool or catch the infections during travel, every infection does build up their immune systems a little bit, and over time they become stronger. Nonetheless, we want the kids to recover quickly from infections. So most of the time we recommend that kids have a healthy diet, a well-balanced diet, especially a diet that's rich in vitamin C, and if you can get fish oil as a supplement, that's useful. Other methods, I suppose, avoiding very, very crowded areas or places that are known to have outbreaks of infection may be a strategy sometimes you need to employ, especially if there's a concern about a child who is very young. But otherwise, I think a healthy diet and maintaining a healthy lifestyle, a good outdoor play, I think a healthy child is a strong immune system. Now, getting a lot of infections doesn't mean that the child is weak. In fact, many kids who attend play school or play group or preschool or infant care fall sick fairly frequently. But as a result of that, they also develop stronger and stronger immune system. So you don't have to be disheartened if your child falls sick frequently, as long as they recover. The next question I have, is it safe? This is from Dreamy Shenzi. Is it still safe to travel when the child is having flu and cough? How do you determine if it is serious enough to reschedule the travel? That's a really good question. I think we struggle with this. I think the younger the child, the more careful we need to be. So traveling whilst sick often happens, and if it's a minor infection like a mild cough and cold, it's just prudent to bring the usual medication along with you. On the other hand, if there are signs that the infection is really serious or the child is really young and there's potential of running into trouble whilst on the trip, then you have to be careful. When in doubt, you can consult the doctor, but usually for very young children, we can go by several parameters. For example, if the child is still playful and active and eating well, generally the infection is probably a mild infection. On the other hand, the child is very lethargic or not eating at all, or there's breathlessness or a lot of vomiting, and your instinct is that you don't feel comfortable traveling with that sort of situation at hand, then seek a doctor's advice before you travel. Any vaccinations advisable before travel? Yeah, that's a good question too. There are several vaccines available now. specifically for seasonal travel. The seasonal influenza vaccine is the number one priority. I think for children 6 months and older, the influenza vaccine is available and safe. So if you're traveling, especially to places that have the winter season, so in the end of the year, the northern hemisphere, or middle of the year, the southern hemisphere, if there's winter for that sort of period, that increases the risk of influenza. So getting the influenza vaccine is, I think, for this season especially, quite an important consideration. Okay. How effective are disinfectants, for example, against respiratory infections in the context of infant care? This is for a question from Nicole TYW from Instagram. I think we've been exposed to a lot of disinfectants through the COVID season, and respiratory infections don't only come from the air. One of the very important sources of a respiratory infection is from contact. For example, from hands. So if, let's say, a parent coughs into his hand, or an adult coughs into his hand and then handles the child, the transmission can be from the contact with the hands. So in that sort of context, I suppose just simple hand washing, not necessarily strong disinfectants, but the simple act of just washing your hands, or just simple alcohol hand rubs if you're not sure, will reduce the risk of infections. Infant care especially, I'm sure all the staff have been trained to kind of wash their hands in between and have hand rubs available. That being said, you can't disinfect everything. So there will be some degree of exposure, and I think a normal level of exposure in every child's life will just expose the child and allow the child to develop his natural immunity. A question from Jung Jung. What medicines are recommended for us to bring when traveling overseas? How much luggage space do you have? But depends on what you need. And also what the age of the child is. Very, very young children, in fact, you may not have many options, because very young children, the options, you have very few options for medicines. The cough mixtures and antihistamines are not safe for them. In which case, then you give some simple nasal sprays, some fever meds. On the other hand, when they're slightly older, you may have to bring something for cough and runny nose, a little bit for diarrhea. You can't bring everything. I don't think it's sensible to bring the whole pharmacy, but I think enough to make sure that urgent matters are dealt with on hand. I think a very useful, maybe sort of precaution is when at your destination, have an idea of what services are available should an emergency occur. For example, knowing where the nearest hospital is, or what the nearest emergency number to call, or at least find from the hotel concierge how do you get a doctor to see your child should an emergency happen. Next question from Instagram, Kaishan's asking, is vitamin C suitable for babies with cough, and will it help in recovery or result in phlegm? Where that comes from, because vitamin C's scientific sort of name is ascorbic acid, and by nature is acidic. So if you're already coughing, sometimes the acidity of vitamin C seems to trigger cough in some kids. On the other hand, the body needs vitamin C to help build up resistance, especially against cough and colds. So giving vitamin C is not a bad thing. I recommend that if a child's really, really unwell and is coughing very badly, supplements don't work immediately anyway. So don't worry about giving too much vitamin C whilst the child is sick, because sometimes the vitamin C ascorbic acid will trigger cough in some kids. Citrus fruits, for example, will trigger cough in some kids. So just deal with it symptomatically, and when the child's well, then you give the vitamin C supplements. Well, just as for those who join us, we are at the Alvernia Live Chat, the last one for 2025. I'm Dr. Terence Tan. I'm a pediatrician working at Mount Alvernia. And today I'm sharing questions and answering questions about holiday infections and how to deal with respiratory illnesses. So leave any questions you have in the chat function, and I'll try my best to get to them. So what's commonly experienced by most parents is the fear of getting a really bad infection when you're overseas, especially if you're in a country that perhaps doesn't speak English or we struggle with the language, or whether culturally the medical services are kind of different from what we're used to. And you worry that the infection is really bad and you get hospitalized. So that's happened to a few patients, and it can be a bit of a traumatic experience. So I think most importantly, be prepared with the basic medication, and prepared how to self-medicate your child. Also know roughly how to get emergency services. But I think very importantly, get some travel insurance, because you may incur additional expenses, medical expenses, if you suddenly need to use medical services while you're overseas. So I find that getting medical insurance or travel insurance helps on that front. A question from TT. How do you tell the difference between a cold and the flu in kids? Are there signs that parents can look out for? Okay, that's a really good question, because the cold or respiratory infection is a generic term. And we sometimes confuse that with the flu, which also can be used as a generic term. But in a stricter sense, the flu, as opposed to a flu, the flu is technically influenza. Influenza is a particular virus that is troublesome and is one of the many viruses that can cause respiratory infections. Unfortunately, it is a very nasty virus. But the good thing is that there's a vaccine against it. So if your child is 6 months and older, you may get your child vaccinated against influenza. Now, how do you tell the difference between a common cold or the usual respiratory infections and influenza, which is a nasty infection? Sometimes it is difficult because there's a lot of overlap. They get fever, cough and runny nose, sore throat. They're very common symptoms. But the severity of the symptoms gives us a clue. In influenza, the symptoms are often much more severe. The typical fever in influenza can be 39, 40, even 41 degrees. And the kids look much sicker. Their runny noses may not be so bad, but the kids are really lethargic, there's a lot of body ache. The sore throat can be really bad. So you can have a clue whether the child has influenza, as opposed to just a slightly droopy nose and a smiling child, low-grade fever. That's probably not influenza. When in doubt, there's a test available, and you can do almost like an ART test for influenza. It's a rapid test, you get the result within a minute or two. If you're in doubt, you can please seek a doctor for advice. Okay, I get a question through Instagram. When can we start giving supplements to our babies? Okay, excellent. Supplementation as a whole is not a bad thing. In fact, we get supplements even through milk formula. For example, many milk formulas are already given, have supplements added into them. Many moms supplement their babies by taking DHA, and even when the breastfeeding supplements go through the moms. And we also supplement vitamin D to babies who are largely breastfed. So supplementation in some degree starts even when they're very young. But supplementation against infections and as a whole, over-the-counter supplementations usually starts from about a year of age, where you can freely buy or acquire supplements from the pharmacist, vitamin C, either in syrup form or in tablet and chewables. DHA, omega-3, fish oils, these are usually safe from the age of 1 year and older. That being said, supplementation is not a magic bullet, so you cannot really say that giving more supplements will protect our kids from infections. It does make them, it sort of fills up the gap. If a child's very picky in their diet, it fills up the gap and whatever that they're missing. But it's not a magic bullet against infection. So the kids will still fall sick. Okay, I've got 2 questions, fairly similar. Agnes from Facebook is asking about a daughter with persistent cough and taken her prescribed medicine. She said phlegm and cough has not improved in more than 2 weeks. Okay, I don't have information on that, how old she is, but I'll go through. Another question from Instagram is, a 9-year-old has been getting dry cough for a week already, recovering from flu and fever, and worried that this will irritate his lungs and throat. And another bout of bronchitis, what can you recommend? Okay, so persistent cough, ongoing symptoms is something we as parents, I'm a parent too, we as parents always face. And there are many things that contribute to cough that persist. Now, giving medicine, and whether prescribed by the doctor or over-the-counter medicine, does help the symptoms and is to relieve the symptoms. But many of these treatments don't cure an infection or don't deal with the cause of the cough. More often than not, these treatments just make the child more comfortable during a period when they are suffering from cough and phlegm. So giving a cough mixture doesn't shorten the course of illness. So that being said, if something goes on for more than a week or two, it may be worthwhile getting the doctor to have a listen to the chest or to make sure that an antibiotic is not required or the cough is not something more serious like an asthma attack or something of the sort. So I think giving the child a week or two is reasonable, but at any point you as the parents feel uncomfortable that things are not going the right way, I think a consultation with either a nurse or pharmacist or even a doctor will be very helpful, because you shouldn't be struggling with something that drags on and you're uncomfortable with. Okay. Soap YZ says, I was asking, may I know if there are supplements that can help the toddler's appetite when overseas? So toddlers is a very interesting group. The toddler age group, they have wills of their own. And so very often, when traveling overseas, you've taken them out of their comfort zone. They're not in a place where they are used to. And some kids, when they're taken out of the usual environment, don't like the food they are given. So an option, I suppose, is to bring the usual food with you, but there's a limit to that, right? You can bring packets of food and all that. Supplementation may or may not help the toddler. So I suppose it differs from child to child. As a whole, I think the principle would be don't force the child to eat. Because if you force anything, anything on a toddler, very often he or she will fight back. And when it becomes a fight, it becomes, it escalates and it becomes really difficult for the parents too. Supplementation, some kids do get improved in appetite with a supplement called lysine, but many kids often just require a bit of time. And if they share food with the parents, more often than not, when they see the parents eating, they'll be happy to try a little bit. And once they find that the food is quite okay, they don't mind eating a little bit. I suppose when you're traveling, it's a special circumstance because you don't have full control over what your environment is. You're in a restaurant, you're in a coffee shop, or you're in the hotel. I think main thing is don't forcibly feed your kids. Don't force it on them, and try your best to kind of have them share food with you. And when possible, bring the food along, some familiar snacks. At least get something to them so that they don't take nothing, and then you won't be struggling with a child who's not taking anything at all. Renee is asking, I have noticed my daughter's tonsils are swelling up when she starts coming down with a cough and flu. What should I look for swollen tonsils, short term and long term? A great question. So big tonsils sometimes can be a fearful thing for some parents. The tonsils are part of something called the lymphoid tissue in human beings. So everybody has tonsils unless you've taken them out. Tonsils are one of the ways part of the body's immune system and swell when confronted with infections. So having slightly enlarged tonsils or swollen tonsils when fighting an infection is a common and in fact normal occurrence. Does it mean it's going to be really bad? I think only in extreme cases where the tonsils are so bad that it obstructs the airways, then it becomes an emergency. But otherwise, slightly swollen tonsils are common. That being said, I know where Renee is coming from, because some kids, over time, their tonsils become larger and larger and stay large. And she's asking about the long term. There is a group of kids whose tonsils over time get larger and larger and contribute to snoring or to noisy breathing when they're older. Now, I think in the long term, if a child is well and despite being well, has large tonsils, especially when there's a lot of snoring, that may be the situation where you may want to consult the doctor. And it's not always necessary to remove tonsils, nor is it always necessary to give antibiotics. And the doctor usually will need to discuss with you what's causing the enlarged tonsils, and how badly enlarged they are. Because if it's very bad, of course, we need to be more careful. On the other hand, if it's only slightly enlarged, we can give it a bit of time for the tonsils to go back down to normal size. Slice of Ivan says, was asking, she's planning for baby's 100 days, congratulations, celebration, and thinking about Christmas gatherings that's upcoming. How to prevent baby from getting sick in these parties? Parties, big family gatherings is one of the most common places kids fall sick, especially toddlers, especially infants. There's no real way of avoiding. If you could isolate a child from anyone, from your family, from the world, a child will not get sick, but that's not realistic, nor is that healthy. So totally not falling sick is also not a normal state of affairs. Falling sick is part of normal growing up, normal family life. So you shouldn't really be afraid of falling sick, but I know you're concerned because she's only about 3 months old. So, and a simple cough and cold may lead to bronchitis or sometimes even more serious lung infections. So you have to be careful. I think anybody who's really unwell in a family gathering, I think try to kind of keep a distance, or make it clear that your pediatrician or your doctor or you as parents prefer that anybody who's sick don't hug and kiss your baby. You know, that's an option. But that being said, I think part of family life means exposing your child to the extended family. So if you feel that your child's healthy enough and growing well, and there are no other ongoing medical issues that kind of need to isolate your child, I think participating in family gatherings is part of growing up. I think use your common sense, use your judgment. I think you won't go wrong. Delicious was asking, is it okay for Sterimar to be used twice a day for a long period of time? Okay, Sterimar, if you don't already know, is a purpose-made mist, a nasal mist. It's a brand actually, and there are other brands, but it's a nasal mist that's made to cleanse the nasal passages of young babies as well as older children and adults. So Delicious is asking whether it's safe to be using. The nice thing about Sterimar is it's gentle and it's a mist and not a strong jet. Secondly, the good thing about Sterimar is not medication, it's just saline. And it is saline or with salt water, and it's saline or salt water that's balanced so that when it goes in the nasal passage, it doesn't irritate the passage or doesn't sting or cause pain. So it can be used over a period of time. That being said, of course, spraying the nose too frequently is irritating and maybe not be necessary. Twice a day is reasonable, and over a period of time generally tends not to be a problem. Just to use it carefully and not forcibly. It reaches a point for young children sometimes that if you do it and the kids are very upset by the process, you have to make a call whether it's worth forcing the child to do it or not. Sometimes it means not doing it and just giving the cleaning externally. Well, for those who have just joined us, welcome to the Alvernia Live Chat, which is the last one for 2025. I'm Dr. Terence Tan, I'm a pediatrician who is at North Alvernia, and today I'm fielding questions about holiday infections and how to keep your child healthy this festive season. Leave any questions you have in the chat function, and I'll try my best to answer them. I have a question through Facebook. My colleague's child refuses medicine whenever he falls sick. Any practical tips for parents dealing with medication resistance? Okay, this is a real practical problem, and slightly older children, it becomes a real problem because it's literally impossible to force the issue. One of my kids was a little bit like that. Then the parents have to make a judgment call. Is it worth fighting? Because many medicines, for example, are basically symptomatic. In other words, you want the treatment to make the child feel better. So then, if the fight to give medicine causes the child to suffer more than the disease or the condition itself, then you ask your question, is it really worth it to force the issue? Sometimes you just have to deal with a slightly runny nose rather than force the child so much. On the other hand, if it's crucial treatment, for example, if it's an antibiotic, or it's something that's really, really important, then reasoning works to a certain point, beyond which you either have to kind of put it in the milk and kind of disguise it. And kids being kids, they're clever, they can taste the medicines. It may reach a point where you have to kind of force the issue. Now, it is a parenting issue, and for individual parents, there's a point beyond which you will not go, and nobody can judge you for that. But I think it depends on how important that medicine is going to be. I think one tip I would say is, first of all, prioritize. If you have 4 medicines, and you give, or the child already finds it so difficult for 4, maybe you choose the most important one, or maybe 2. It makes it less arduous for him or her, and it's also, and the other 2 less important medicines you drop it. Secondly, be calm. I think if we as parents get excited and worse, get upset and angry, it just makes it worse for the child. I think if you're calm and steady, that calms the child too. Anything beyond that, you just have to kind of use your judgment. Try your best not to kind of be too forceful, but be firm if you need to be. Do out of everything, do it lovingly, and I think you'll be okay. Hand-foot-mouth disease sounds scary. Is there effective treatment for hand-foot and mouth disease? Okay, that's a good question. Hand-foot and mouth disease, or HFMD, is caused by a viral infection. And so, as you know, viruses don't respond to antibiotics. So the best way to kind of, in a sense, fight hand-foot-mouth disease is to avoid it, but it's not preventable. We currently don't have a safe or effective vaccine for in general use in Singapore against hand-foot-mouth disease. So more often than not, our kids will catch HFMD in preschool or in swimming pools or public areas, playgrounds. It's part of growing up. And so it sounds scary because for some kids, HFMD can be very severe. In fact, in the year 2000, there was a hand-foot-mouth outbreak called the EV71 outbreak that actually caused fatalities. But that's no longer the situation. Most HFMD infections amongst our kids brings a very mild infection. In the worst case, it causes severe mouth ulcers, and the kids need to be admitted for an IV drip because they don't eat or drink at all. But by and large, most kids get through it after a few days of pain, and they get some milk in, not perfect, but if they get some liquids in, that should be enough. Now, most importantly, if it comes down to eating or drinking, make sure they drink, because hydration is the #1 priority for hand-foot-mouth disease. When a child is hydrated, they can produce enough saliva, and the saliva will lubricate the ulcers to some degree, and the ulcers don't hurt so much, and hopefully they can maintain hydration that way. If the kids don't even drink, the mouth becomes dry and the ulcers hurt terribly, that's when they end up requiring hospital stay and IV drip. So the priority will be to keep the kids hydrated. Cold milk. In the slightly older kids, maybe jelly or soybean curd. In the West, they tend to give custards. Keep it cool, and jellies. It's easy for the kids to swallow and eat. I had a baby once who had moderately bad hand-foot-mouth disease, and the child got through without hospital stay, but the parents got hand-foot-mouth disease because for some reason the close contact it's contagious through saliva and the poop. So the parents got it, and the dad was hospitalized for severe hand-foot-mouth disease, and he needed the IV drip. And so it's no joke for sometimes even for the parents. So yes, it can be scary, but try to maintain hydration, and that usually will get the kids through. Okay, so we are coming to the last stretch of our session. We have about 5 minutes left. Thank you for the very interesting questions. I think it's something we all as parents face, not just every holiday season, but every day. Every time our kids go to preschool or infant care, we face this. I can take another 1 or 2 questions, and feel free to leave comments, and our team at the Alvernia will be happy to help you out. Okay, I got a comment. Thank you for having time with us. Can I know how many days can kids be between 1 to 2 years be given cough syrup continuously? Okay, so she's asking How many days for a toddler between 1 to 2 years can be given cough syrup continuously while waiting for recovery and from cough and runny nose? Okay, that's a good question. The good thing about most mixtures that doctors prescribe or over-the-counter mixtures is that generally they're very mild. Many of them are herbal in origin or herbal extracts, and many of them are not even very strong medicines. So the duration can be a bit extended generally without any harm. But that being said, if you have something that's going on for a week or even 2 weeks and that's not going away, the question needs to be asked. It's not whether the medicine is safe, but you have to ask as parents, you have to ask the question, are we dealing with something more serious? Why is it not going away? And that's when you may need to consult the doctor or at least get some opinion from somebody. But if in doubt, don't give any medicine for more than 2 weeks. Okay, so I think most parents, you can trust, as parents, we have an idea of what our kids are like. So if you find that the kids are healthy and are generally just having minor ailments like cough and colds, you're free to self-medicate as long as you're comfortable with what you're dealing with, the types of medicines he's used it before. But if you're dealing with something you're not sure with, that's when you ask for help. A parent in my circle asks, when is it safe for a child to return to childcare after flu? Is it based on days or symptoms? That's a good question. Often it's both. Usually a viral infection takes 3 to 5 days to get better. Within that time frame, up to a week, it's contagious. So in line with civic mindedness, at least the first 3 to 5 days, you don't want to pass it to your friend, to your child's classmates. If the child's it's a very serious infection, at least 3 to 5 days, and the child's well before going back to school. If let's say the time is up, it's up to 5 days, and the child's still very unwell, I suppose extending it to a week is reasonable. But yeah, about the first week. How can I differentiate if my newborn phlegm is normal or my newborn has bronchitis? Excellent question, because that phlegmy sound in newborns, on one hand, can be harmless, but on the other hand, if it's bronchitis, which is a lung infection, can be something nasty. And in the question, it says newborn, which is all the more frightening because newborns can get really sick if it's in the lungs. Very often, there are some key indicators when it comes to dealing with a newborn. If it's just the wet sound, often it's not phlegm. It may be just a bit of saliva or a bit of milk in the back of the throat. I think if a newborn baby has a fever, you need to seek help. If it's really phlegm or respiratory infection, there will be other indicators. For example, a newborn feeding will drop, will not feed at all. Or the breathing rate, the baby can be breathing hard. Often the babies will be coughing a lot or coughing until vomiting. Or a combination of all 3 symptoms, breathing hard, poor feeding, and vomiting a lot. Now, a newborn usually will not tolerate bronchitis very well. So I think it's usually quite clear if a child is sick with bronchitis. On the other hand, if you have a very well baby and has only just a phlegmy sound, often it may not even be true phlegm. It may just be a bit of saliva or a bit of reflux that gives you the wet sound. When in doubt, ask the doctor to listen to the baby's lungs. Then he can clarify that for you. How can is it okay for a child to be constantly on antibiotics when down with bacteria every once a month? Okay, I don't know how old the child is. We don't like antibiotics. In fact, doctors are called to be what we call gatekeepers of antibiotics. Antibiotics is something that we as doctors don't like to use frequently, because the more we use antibiotics, the less effective it's going to be in the community. So immediately I'll tell you it's not that okay. So Casson the Role was asking, is it alright to be when bacterial infection is down once a month? So what happens is that antibiotic usage is usually prescribed by the doctor. So the doctor will advise on whether or not antibiotic needs to be given. So very often the doctor will need to make a judgment call. If the infection requires an antibiotic, I think you probably have to listen to the doctor's advice and go ahead with it. And even if it's slightly more frequent than you're happy with, simply because if it's medically required, that is the requirement. On the other hand, if it's very frequent, you need to ask the doctor, why is my child getting so many bacterial infections? Is it because the environment is no good? Is it because the child's immune system is not strong? It's something we need to look into. But I think you have to leave it to the doctor's judgment to decide whether, in each instance, whether an antibiotic is needed. Well, thank you for joining us today. It was great answering all the questions. It was very interesting, and it's very practical because we deal with this every day. In case you miss any part of the talk, I think the Mount Alvernia team will share some cut downs of the video on social media. If you have any specific needs or you need advice, feel free to reach out to us at Mount Alvernia. This will be the last live session for this year. Follow us on social media on Facebook, Instagram, TikTok, and keep up to date with 2026 on the next live update. See you again.